other denturists were to run a system where they're out there educating their patients, or showing them this, or showing them the different types, we've got with the guides and with the videos and so on and so forth,
Yeah.
Like we talked about earlier this week, like, how's it working, right? Like, I mean, you're seeing.
Yeah. So no, it's going extremely well. And the thing that surprised me the most is that we're running let's say our funnel or our ads based on dentures, but over 50% of those patients immediately are putting on the form that they're interested in implants. So before even coming in the door, they already have it somewhat in their mind that, you know what, I was online, I've seen this before.
Right.
What can you tell me about this? Right. So that's immediate consultation, first try. So immediately they're asking me that. Now, next appointment, I have a denture already set up for them, some kind of a plan set in place with the DDS or with the dentist or even the oral surgeon, with some kind of not an upgrade plan, but an overdenture plan, because you asked about it originally. So
Right.
here's kind of something else that we can offer you. But it's amazing to think that they're seeing a denture ad, but because of the education online, they're immediately asking about implants. And easily over 50% of those patients, for sure. And a lot of them are quality patients that really were interested, just didn't know really where to go, right? And didn't really know what questions to ask. So feeding them the guide and giving them that pre-information or the pre-education before they even come in really, well, makes my job easier for sure, because they're already up with the times. They kind of know what we're getting into before we even sit down.
Right. Yeah. They've been educated. They've been pre-framed and qualified. Right. And actually just some intimate questions that we ask them that force them to kind of think of, what is bothering me and how is it affecting my life? Like, no one's asked me that. Right. And different things. Right. And so, that's
Being
really
able to follow the guide as well, or follow those questions that they've asked. You get a copy of that. So I can actually check it and immediately see, okay, this is exactly what's bothering them. I have some kind of ammunition to go by, not to sell them on a better product, but to connect with them better and let them know that I have a solution for you. It's not going to be dentures, but we have it all on four. We have an overdenture solution that's much better than what you thought it was when you first signed this and first wanted to come in for this consultation.
Right. Empathy. Right. I mean, it's empathy. And like, it comes down to one word. It's always empathy. And that's really what you've shown them initially. Yeah. In beforehand. And then when they call in, that's reinforced, right? That empathy is essentially reinforced. So yeah, we're really grateful for that.
With them of right away of what they're having trouble with, what expectations kind of they have as well, what expectations they have of you and your practice. That's immediately put into the frame of mind that you know what's coming in and you know how to react to that patient before they even sit down.